With the historic shifts we're seeing with programs like Medicaid, Medi-Cal, comes the opportunity for us to deepen our partnerships to center the voices of families. H.R. 1 and other policy changes are a reminder that those closest to the problem are closest to the solution. Something our speakers, Family Voices of California, Family Resource Centers, Family-to-Family Health Information Centers, our funders have long recognized, as has our next speaker. This is really a big honor, and she's taken a lot of time out to come here in a very busy schedule, so we're really honored to have Assemblymember Bonta with us this morning. Ms. Bonta represents California's 18th Assembly District, serving much of Oakland, Emeryville, and Alameda. She serves as the chair of the State Assembly Health Committee. Whether sponsoring AB 2161 to limit the administrative burden from work requirements as a result of the new federal Medicaid laws, to advocating through AB 298, a bill that we worked on with her this year and we hope to see back soon, to ensure that families can take their children to the doctor without worrying about prohibitively costly copays. Assemblymember Bonta stands with and for children and youth with special health care needs. Many of our families and attendees have had the pleasure of testifying or supporting bills in front of the Health Committee, often at her invitation. A lifelong advocate for students and working families, she has centered the voices of children and families in her decades of experience, leading education-focused nonprofits and advancing policies that promote affordability, equity, and opportunity. Her journey from community leadership to public service reflects a deep belief in the power of education and inclusive systems to change lives. Please join me in welcoming Assemblymember Bonta.
Thank you so much. It's wonderful to be with you all this morning. I actually drove up madly from Oakland, from Alameda, to be able to be here, and I'm headed back down right after this to San Francisco, so very important for me to be joining with you this morning. I want to thank Janice and Wendy and the entire Family Voices of California team for bringing this summit together. Year after year, you all create the space for people who matter most in this work. Our children, our parents, our caregivers, our advocates, our clinicians, to come together and say, we see the system, we know what's broken, and we are not going anywhere. Yeah. So I want to thank you all for making sure we have an opportunity to talk. Slides, no slides? No slides, okay. We are going to send some slides for you post. I just wanted to share that I'm so thankful to be able to represent the beautiful people of Oakland, Alameda, and Emeryville every single day in Assembly District 18, and I currently serve as the chair of Assembly Health Committee. Earlier this year, I became the founding chair along with about 41 members of the legislature of the California Legislative Children's Caucus. This is my heart's work, something that I wanted to do when I joined the Assembly in 2021, and really when I was pressed with this moment in time, knew that it was an opportunity for us to be able to come together. So I'm wearing both of those hats today, and both of them bring me here today with some great urgency. I wanted to talk a little bit first about the numbers that we know are true, and this will ground us in some of the conversation that you all are having today. 55% of California's children are enrolled in Medi-Cal, more than half, accounting for around 5 million of our beautiful children. This is not a marginal population or some fringe members who rely on the social safety net. It is the majority of our children. Medi-Cal is the backbone of our children's health in the state. For bad, good, evil, We're wonderful. And because of deliberate policy choices, Medi-Cal expansions, the Affordable Care Act, California's own commitment to health for all, we drove our uninsured rate to a historic low of 5.9% in 2024. That is something that should be applauded. And that's down from over 17% just a decade ago. From 17% down to 6% in a decade. That's progress. We should be proud of that. That progress didn't just happen by accident, though. It happened because of you all. It happened because you all fought. You fought for health for all. It happened because you showed up in committee rooms, in hearings, in the streets, and demanded better for our children. That progress took decades to build, yet it is incredibly fragile and vulnerable to being undone by a single reconciliation bill. So let's talk about that bill. Let's talk about H.R. 1. I won't call it what that guy calls it. I'll call it what it is. There are 3 ways that our families are going to be losing coverage under H.R. 1, which cuts $1 trillion to Medicaid. Through erosion and bureaucratic mechanisms, those cuts are costing our families. They're intentional. First, there's the issue of disproven work requirements. Beginning in 2027, our working age Medi-Cal population will be subjected to disproven work requirements, not because they are not working, but because the federal government wants to keep our families from being able to succeed. I call them disproven because we have the evidence. States that have tried Medicaid work requirements, such as Arkansas, showed that these policies do not increase employment. In fact, what they do is increase paperwork and bureaucracy. They increase coverage losses, and they fall hardest on the people least equipped to navigate a new bureaucratic burden. The UC Berkeley Labor Center estimates 1.9 million Californians could lose Medi-Cal for this provision alone. And I also want to be very clear and direct with this room. There are exemptions to these work requirements for caretaking responsibilities and for medical frailty. Those exceptions must be claimed and documented. So while many on paper in this room will be exempt in theory from those work requirements, the reality is that those exemptions, because they require such high level of documentation, will cause so many who don't have the wherewithal to be able to meet those requirements time and time again. So this is a real and immediate risk for families in this room, for families who haven't even found their way to be able to navigate into rooms like this, and so many more. So we need to work in tandem to fix that, and we cannot afford for California to unnecessarily pass this harm onto communities where we can avoid it. Second issue with H.R. 1 is the 6-month re-verification. H.R. 1 requires states to verify Medi-Cal eligibility every 6 months instead of annually. That means more forms, more deadlines, more opportunities for a family to fail and fall through the cracks, not because they lost eligibility, but because they missed a letter. An estimated 270,000 Californians are at risk from this provision alone. Third, immigration status restrictions. H.R. 1 restricts Medi-Cal access for undocumented residents, refugees, and asylees, and people who are fleeing from sexual violence. Estimated 200,000 Californians could lose full scope coverage. Many mixed status families are already living with that fear today. Now, we know that millions of Californians could lose coverage. 3 million Medi-Cal enrollees, 400,000 covered California enrollees, which is another important part of this picture. And for a child with special needs, losing coverage doesn't just mean losing a card, it means losing their care coordinator, their specialist, their plan, their support system. When you add those 3 mechanisms together that we talked about, the aggregate picture is alarming, to say the least. A UC report estimates nearly 3 million Medi-Cal enrollees could lose coverage by 2028, along with up to 400,000 covered California enrollees. But I want to be specific about what those numbers mean for the people in this room. For a child with special care needs, losing Medi-Cal doesn't just mean losing a card, it means losing their coordinator, it means losing continuity with the specialist they've had for years, losing enhanced care management, losing the pathways into CCS, losing IHSS support. We know that these are vital services that will take years to rebuild if we don't act. State-level cuts for certain immigrant adults in response to the loss of federal funds have already gone into effect. We are not talking about future risk, unfortunately. We are talking about the risk that is hitting us today. This historic moment has lowered uninsured rates that we just celebrated, but we know that we are in danger of reversing those incredible uninsured rates that we experienced before. And for me personally, this is not acceptable. For many in the legislature, it is not acceptable. I want to talk a little bit about the work that we are doing and what we are tracking in the Assembly Health Committee and throughout the Assembly. I want you to know that the legislature is not waiting for the damage to arrive and then react. We spent time over this legislative session, in between sessions, leading conversations with stakeholders across the state, in Fresno, Santa Rosa, the East Bay, up all down in San Diego and Los Angeles to understand the true impacts of HR 1. And we culminated those conversations with an informational hearing in the Assembly Health Committee in January. And earlier this month, I co-chaired a joint informational hearing with my counterparts in the Senate Health Committee. Across both of those conversations, or all of those conversations, we heard from county providers, everyday people, and advocates like you from across the state. We heard about the federal changes and what that would mean, and we also heard about the actions that the state budget actions and the impacts of those. And right now, the committee is actively tracking legislative options to protect coverage, monitoring county safety net capacity as Medi-Cal contracts are eroded, and closely watch how work requirements will function in practice. I will again be direct with the people in this room. The state cannot fully replace federal funds. For every dollar the state puts into our public health care system, 3 are provided by the federal government. Yet, I want to be clear, those are our tax dollars. And we're going to fight to get them back. But we can build guardrails, we can close gaps, we can do what we can do in this moment in time. Our job right now is to stand in the breach together. So one of the ways that I knew that it was important for us to be able to stand in that breach together was to launch the Children's Caucus, the Legislative Children's Caucus that I mentioned. We are bipartisan, we are bicameral, we are 40 members plus strong in the Assembly and Senate. Why did we decide to do that this year? Well, 1 in 5 children in California live in poverty, in the 4th largest economy in the world. Child poverty more than doubled since 2021, rising from 7.5% to 18.6% in 2024. That is a policy failure, largely driven by federal decision-making, yet it is a policy choice we must reverse. So the bipartisan piece of this matters. When Republicans and Democrats stand together on children's health, and we are, in this caucus, it means this is not a partisan fight, it is a California fight. We're focused on 7 different pillars around early childhood and child care access, physical and mental health, child welfare and foster care, youth justice and shared safety, housing security and environmental sustainability, economic security, and financial literacy. And we are organized around the full spectrum of children's needs. Early childhood, from the time that you were born to the time that you are thriving and 25 and an adult in this world. For this room specifically, I want to ensure I also highlighted physical and mental health as a core caucus pillar, because of the work that you do fighting for Medi-Cal, for CCS, IHSS, ECM, so many letters, my goodness, has a dedicated, so many important letters, has a dedicated home in this caucus. I wanted to spend a little time talking about some of the legislation that I am focused on this year. Some were mentioned earlier. I really appreciate your incredible partnership in that work. First, I wanted to mention AB 2161. So this directly addresses the federal Medi-Cal work requirements in HR 1. The bill prevents California from implementing those disproven work requirements because California doesn't need to implement MAGA hate. We're going to work to minimize the impact of those work requirements, shoring up our county system so that we have as many resources as possible to support us in this moment. Also, AB 2348, which strengthens CalAIM community supports and enhanced care management. So the framework that houses the enhanced care management and many of the community supports this audience and you all folks navigate every single day. When this system works, it is transformative for children with complex needs. We are working to make sure it keeps working because right now, much of CalAIM sits as an executive discretionary implementation point, right? They were innovation priorities, but something that with a gubernatorial transition, we could see de-emphasized. So we want to put in statute the incredible importance of enhanced care management and the overall intention of CalAIM so that it is very clear that from a legislative standpoint, a statutory standpoint, we intend to secure the resources that we know made such a big difference when we thought more holistically about healthcare. And finally, I'll talk about AB 2368, which addresses indigent care. As HR 1 pushes family off of Medi-Cal, county indigent care programs became or will become the last safety net. Many of these programs have been operating at a diminished capacity for years because Medi-Cal has been catching more people. Well, now that we know that Medi-Cal and the ACA are at risk at significant levels, we know that people are going to be turning back to needing our county's indigent care support. And we are going to make sure that we're kind of standing up a safety net system that can withstand the federal onslaught of an agenda that doesn't match California's agenda. And we shall see if we need that. But I wanted to make sure that we have something in our backpack here in California. I wanted to mention two non-health related, well, not specifically health related, but very important to children and to children in this room, pieces of legislation. One is AB 1969. It takes a village. It's an act that this is my third time bringing forward this piece of legislation, so I am being resilient and I am focused, and we're going to get it across the finish line this year. And it establishes a 3-year grant program to build cradle-to-career networked statewide coalitions rooted in community and building up our community supports. And it is a reflection of the work that I did before I came to the state of California, recognizing that when all of our systems are organized and coordinated around our children, our health care, our safety net, our housing programs, our education systems, that it means great things for kids. So excited to be able to push forward with that. And then AB 1996, No More Child Poverty Act. It is reprehensible that 1 in 5 children in the state of California experience poverty. And I'm going to demand accountability from this state. So we're going to set clear and measurable goals to cut child poverty in half within 10 years. We're going to do that by putting in an 18-member accountability council to hold us to it. Because in the largest economy in the world, child poverty is a policy choice, and we are choosing differently in the state of California. So please look out for that piece of legislation. And finally, I will just end with this. Our lived experience is, and expertise is, I should say, our, in the legislature, call to action. Your lived experience, our call to action. So you all are here because you are kicking off a time when you are going to be visiting many folks to just make sure that people are very clear about what your daily reality is. So I'm going to make a direct ask of you, because you did not come here today just to listen to me and to listen to amazing panelists. Alex, by the way, thank you so much for the prior presentation. You came to figure out what we do next. So I'm going to be specific with you. First, speak up. Your testimony changes minds. Lived experience is expertise. I say that and I mean it, because sometimes what moves legislators the most is not the facts, it's not the data, or our particular belief system. Sometimes it is the parent who stands up and says, here what your policy means to my child. We need those voices in Sacramento. The second thing I'll ask is for you to connect. Meet with your legislators and their staff. Don't sleep on the staff. Those are the folks who take a majority of these meetings. They sit there listening intently. They are subject matter focused often, and they're the ones who are able to translate your conversation into policy and into recommendations that then your state legislators will be able to carry. So I wanted to just make sure that you all promise to me that you will make a commitment to connect. Because we want to hear from you. Sometimes it's hard. Sometimes we avoid those conversations, but we want to hear from you. Lastly is submit. Submit letters. Submit your 2-minute testimony or your 1-minute Me Too. As a committee chair, I want to say that those submissions carry a lot of weight. We look at the letters. We often, in our individual offices, pay attention to the number of calls that come through on a particular piece of legislation. It impacts how your legislator votes on things. And I want to say that take a letter, make sure to submit that, make sure to get it in, pick up the phone, put in the call. They all matter. Now, California has done this before. We've been in this moment before. We know what we need to do. I know you're tired. I know you're a little weary. I know it would be better if you could spend time taking care of your child than having to be up here convincing us in Sacramento to act right on your behalf. And I'm sorry that you have to be here. This moment calls for you to be here. This moment calls for us to put aside our weary, put aside our tired, and make sure that we're coming together to fight. Fight for our children every single day. We've been here before. We know what it means. Coverage losses are coming unless we act. I can't minimize that. But California, we have been here before. We expanded Medi-Cal when Washington contracted it. We showed a new path forward when we made Health for All a reality. We stepped up when we built a comprehensive CalAIM system. We have a track record of doing this and doing it well, despite what is happening in the federal government. I believe, as many in our Children's Caucus believe, I believe this as Assembly Health Committee Chair. I believe this because I know your hearts believe this. Sometimes we have to operate on hope. And I am waiting for that lucky moment. You know what luck is? It's when opportunity and preparation meet. That's all it is. You know what hope is? It's you all waking up every single morning. It's kissing your babies. It's making sure that they're okay. It's telling yourself that I can make it through another day. It's getting on a bus or a train or however you got here up to Sacramento to say, I have hope enough in my heart for my child and for you all and for California that we can do right. I know you're tired. I know you are weary. We are in a fight. We are in this fight together. We are in the fight of our lives for our children. I need you up here being strong, being powerful, being the family voices of power that you are, to make sure, because our children will ensure that we win. Thank you.